Namaste, I am Dr.S.Jayaraman, consultant pulmonologist, Sri Jayam Chest and Sleep Clinic, Aminchikarai. I am a consultant working in MGM Healthcare, Billroth Hospital and Apollo Firstband Hospital. World TB Day. Every year in the month of March 24th, as per WHO recommendations, so we are celebrating, in the sense creating awareness. In the year of 1882, Dr. Robert Koch is a German microbiologist, scientist who discovered the TB bacilli. That day he announced TB is caused by Mycobacterium tuberculosis. That is a commemoration, that is the memory of this day. We are doing a World TB Day every year in the month of March 24th. So this year theme is yes, we can end TB. So TB is, you all know very well about that, this is an infectious killer disease in the world. In Indian scenario and African scenario, there are a lot of our country is one of the endemic country of TB. TB is a completely 100% is a curable disease. So early diagnosis is very important. So if you diagnose early, so without any scar, we can cure completely. Otherwise, if you diagnose TB lately, very late, so there are a lot of comorbidities, mainly in the form of sequelae of tuberculosis. We come across a tuberculosis associated obstructive pulmonary disease, requires a long-term treatment and with the poor quality of life and all. So TB is a 100% curable disease. So tuberculosis, TB, this is caused by acid fast bacilli, is a type of mycobacteria. 80% of TB is affected by affecting organ is the lung. Lung is the main organ. 80% is the respiratory system. So the 20% extrapulmonary TB, mainly the pleural cavity, lymph nodes, mainly the cervical lymph nodes, axillary and mediastinal lymph nodes, and brain tuberculosis, TB meningitis, bone tuberculosis, Koch spine, spinal tuberculosis, renal tuberculosis, skin tuberculosis. It affects head to foot all the organs. So we need to have a proper awareness. In pulmonary tuberculosis, the common symptomatology, cough more than 2 weeks and fever and evening rise of temperature, blood while coughing, weight loss, loss of appetite. These are the common symptomatology of tuberculosis, pulmonary TB. And how to diagnose tuberculosis? So more than 2 weeks cough, so any sputum, we do the sputum test for acid fast bacilli and we do a gene expert. This is a rapid culture to diagnose 100% whether TB is there or not. Some NTM, non-tuberculous mycobacteria, we need a regular culture, MGIT culture method to prove TB is there or not. And chest X-ray is a very important tool to see any opacity, cavity, any consolidation, pleural effusion we can diagnose. So once you confirm the TB, the treatment of active TB, TB is the 6 to 9 months short course chemotherapy. So we have to follow meticulously. We advise a patient day 1, you must continue the treatment for 6 to 9 months, depends upon the lesion. If the patient has a lymph node TB or bone TB, we may extend up to 1 year. So the adherence of treatment is very important. Along with we have to control, we have to avoid all the risk factors like smoking, alcohol and poor intake of diet, etc. Respiratory etiquette is very important. Any family members is having active TB, we have to prevent others by checking screening contact. We have to do the contact screening and find out if any positive. The screening methodology, mainly the Mantoux test, apart from clinical, Mantoux test and quantiferon TB gold test are very important. If it is positive, we have to give a 6 months course of the INH prophylaxis for 6 months to prevent an infection, to prevent a disease. From infection to disease, we have to give the TB preventive treatment, TBI. So this is very important. So to prevent complication, early diagnosis is very important. So without any neglecting the symptoms, we have to start the treatment. In the case of extrapulmonary pleural effusion, we have to remove the fluid under the ultrasound guidance, send it for the routine analysis like protein, LDH to find out whether the patient has a transudate or exudate, and adenosine deaminase level is very important. Cell count, mainly the lymphocyte count, is very important, and cytology, gene expert, other methodologies to prove patient has TB or not. And the extrapulmonary diagnosis, tissue diagnosis is very important to confirm the TB. Sometimes malignancy can mimic tuberculosis, so biopsy is sometimes mandatory to confirm the diagnosis. So early diagnosis is a complete cure and completely we can avoid all the permanent damage, no TB sequelae if we take the proper treatment. So in this World TB Day, yes, we can end TB. Our motto is end TB by 2025. So this is our motto. So we have to create a world TB free Chennai, TB free Tamil Nadu, TB free India, and TB free world. For that we have to work together, private and public partners, government and private, and so we have to create a lot of awareness among the public to have a complete cure if you diagnose early. Don't neglect any symptoms. These are all the things, take messages from this World TB Day. So we can end TB is the Taraka Mantra of this World TB Day. We have to fight against this deadly disease. So this is the World TB Day mantra. We have to follow each and every aspect. Diagnosis treatment is very, very important. So regarding this World TB Day, there are a lot of take-home messages, lot of programs. I request everyone kindly attend and update your knowledges. Ultimately, we are helping the patients. Thank you.